Among students, tuberculosis is neglect syndrome. The neglect is spatial neglect, hemi-neglect, and hemi-spatial neglect. Contralateral neglect or unilateral neglect, some this case of subtypes. The daily is to right parietal lobe. The result of the patient completely ignoring the left side of the world, even the left side of the body. Patient eat only food on the right side of the palate, show the right side of the face, wash the right side of the body, etc. The problem of attention or not blindness. Most are commonly observed in the stroke or accidental victim can sometimes occur after some similar damage to the left palate and much less frequently and in a milder form. Types of neglect. It is sensory neglect, motor neglect, combination of sensory and motor neglect, and conceptual neglect. Okay, the mainly visual, tactile, and auditory stimulus is affected. Then conceptual neglect is what is the anosognosia is the lack of awareness of the lack of awareness of hemi neglect. Also seen in the ventricular aphasia, venicial aphasia, frontal lobe difficulty. Okay. Then anosodiporrhea is aware of disability but no emotional concern or distress. Asthmatogonosia is that the L body is part of the then copying. These of the items are missing. The copying items and the spontaneous drawing items are missing in the neglect syndrome. Then these are the things of the pictures of the missing of the elements is the hemi-neglect syndrome. Then hemi-neglect is the inattention to space contralateral lesion. Inattention to space contralateral lesion. Okay, lesion is occur. Brain is the contralateral lesion. The right side brain affected. It's a extremity is the right side upper limb and lower limb is the neglect is present. Then functional anatomy of the unilateral neglect is the unilateral neglect is a not parietal syndrome. Unilateral neglect is a not parietal syndrome. Rather, it's an attentional network syndrome. Attentional network syndrome is a parietal sensor neglect or frontal motor neglect. This pathway is the thalamus striatum. This is the head of the pathway is the thalamus striatum. Is posterior parietal cortex, frontal idled, then cingulate cortex. These are the most structures affected is unilateral neglect syndrome. This is a pathway. First we'll go for prefrontal cortex. Then we'll go for associative cortex area. Then it will motor processing. Next we'll go for cingulate gyrus. Then we'll go for hippocampus, antithalamic nuclei and hippocampus. Then we'll go for mammillary body and rest of hypothalamus. Next we'll go for brainstem. Then difference between the hemi-neglect and hemi-anophia. Okay. That is the detecting the stimuli awareness of the detect modality extension contralateral cueing. And no often multimodal common improve neglect. Is hemi-anophia is yes visually only unusual no effect. Then neglect text is a line bisection bias, drawing, etc. The hemi-neglect is a ipsilational lack of contralateral details. This is a none or contralateral lesion normal. Exploring space, contralateral circuit and object search test. This is a decreased contralateral neglect. This increased contralateral emphasis. Then side of the parietic lesion, more often right side of the non-dominant hemisphere. The right or left anyone is common. This is the MRI findings, the CTR findings. The cortex areas, the focal lesion is the white color lesion is the affected the lesion. That is a parietal lobe is mainly for focus on this structure. This book is our reference for the principles of neurology. Book reference. The sensory syndrome in parietal stroke. This is one of the article journal. Said that the article the upshot is that we studied out 20 patients with acute parietal stroke with hemisphere disturbance but no visual field deficient and no or only slight motor weakness. Without thalamic involvement on the CTR MRI found 3 main sensory nodes, pseudolome on sensory hydrolome, then we'll go for cortical sensory syndrome consists of isolated loss of discriminatory sensation, stereognosis, apathesia, and the positional sense. The 2 parts of the body. The patient shows superior posterior parietal stroke. Then it is mainly for the This is a neurophysiological dysfunction is present in the 17 patient. Neurophysiological dysfunction is present in the 17 patient. The only constant association of the between the conduction aphasia and the right side pseudothalamic sensor deficient, we conclude that parietal stroke can cause the different sensory syndrome. Depending on the topography of the underlying lesion, sensory deficient can be monosymptomatic but never from pure sensory stroke. Face, arm, leg, and etc. There is a middle cerebral artery supply. The cortex is mainly for the middle cerebral artery, posterior parietal lobe, angular, posterior temporal lobe, inferior division of the middle cerebral artery, visual radiation, temporomandibular, temporopolar, subdivision of the middle cerebral, lateral orbital frontal, prerotalandic, and the rotalandic is the main supply of the middle cerebral artery. Then as you go for cortex area, the cortex is mainly for the midline structure. The midline structure is mainly for the lateral ventricle. The lateral ventricle is a cardiac nucleus, internal capsule, then putamen and globus pedulus. Then go for MCS division, then inferior division, middle cerebral stem, internal cardiac artery, flesh wound artery, then antecerebral artery. This is of cortex area. Egocentric and allocentric is based on the distinction between the reference stream of the user. Egocentric is also called as neglect of the contralateral side of the view of the patient. Also called as the stimulus-centered nucleus. Neglect of a contralateral side, some patient can both develop nucleus syndrome. Principles of the treatment is for the focus on the shifting attention for the two left view and increasing the sustained attention and size of the view central attentional space. The recapitulation stimulus is centered is focused on the shifting attention for the two left stimuli or the size of the stimulus. Treatment of the egocentric view is the prism adaptation, caloric stimulation, transcranial magnetic stimulation, vibrational stimulus of the posterior. Okay, there is another study. The single case study is mainly for the attention window of the studies. Improved the left side target of the stomach circulars to the block of facial. It hypothesized the improvement of increasing size of the attention window of the last cycles.